what are the common gynecological disorders which are encountered in the adolescent age group?
Well, you must understand that adolescence is a very delicate and unstable phase of a girl's life. So the two common diseases which you often encountered, one is endometriosis and one is polycystic ovarian disease. It starts from the adolescent period, even from the very early age, particularly endometriosis. It starts even before adolescent age, and even it has been detected in the intrauterine phase of life of a girl child. So you can understand there is a big difference between onset of the disease, particular disease, and the manifestation of the symptoms. Another one is polycystic ovarian disease. I'll come to that later.
Okay. And sir, in relation to, as you rightly mentioned, the two most commonly encountered problems are the endometriosis and the PCOD. So in
Exactly.
relation to the endometriosis, how do you look it from the problem point of view and from the perspective of prevention and the treatment of endometriosis in adolescent age group?
Okay. First of all, the adolescent girls, they must know what is endometriosis. Endometriosis is a very vague 300 years old disease, and even we do not know now what is the cause of the disease. The main manifestation in the adolescent girl is the painful menstruation. Every girl is supposed to have some pain during menstruation, most of the girls. And we have seen from our studies from Endometriosis Society India that 1 out of every 3 girls who is having pain during menstruation is destined to have endometriosis in their future. So our main motive is to prevent, make them aware of this condition, and to start treatment immediately, so for detection and other parts of the treatment is concerned. And if it is not being treated, or if it is kept as such, or if it is ignored, subsequently there are a lot of problems. What are they? Number one is subsequent failure to conceive, what is known as infertility, as you know. That is one part of the story. The other part, it is such a painful condition. Every month she is supposed to get a lot of pain during menses, and gradually with time, it has become a chronic phenomena, chronic pelvic pain. Apart from various menstrual problems, irregularities, excess of flow, and pain here and there in the body, back pain, pain during passing urine or passing stool, and various vague symptoms, including a lot of psychological symptoms like depression, lack of sleepiness, I mean insomnia as we say, and all these conditions appear. So in young girls in the adolescent group, when you see 2 or 3 points, one, this painful menses, second, the lack of interest to go to the school during their menses, and third, to take part in the socio-cultural activities and different physical activities during that period, the guardians and parents, they should take it seriously and should consult a doctor.
Right, sir. So, sir, another commonly encountered problem in adolescent age group is PCOD. So, how do you look at PCOD from the perspective of prevention and the management views?
Yes, actually both these diseases, I call it twin sister, being ovular, dizygotic twin sister. One is boy, one is girl, like this. So polycystic ovarian disease is another problem which is most often seen in younger girls. What is that? What happens? Most of the girls, as soon as the girl enters our chamber, we instantly make a diagnosis that it's the case of polycystic ovarian disease. How? The girl is a very obese, fatty girl, young adolescent, but very obese. Next complaint, sir, I am not having menses for 2 or 3 months, or I am skipping menses. I had my period in time, but after that I am not having it for quite a few months, and again I will have it. So it is very infrequent. So that with that classical problem of obesity and menstrual problem, plus minus some features of hyperandrogenism. Hyperandrogenism means features of male characters like excess of hairs in the face, mustache, beard, etc., in other parts of the body, legs and chest, etc. Though if those features are there, then without doing any other investigation, you can come to a conclusion, yes, she is suffering from polycystic ovarian disease. Now, this particular disease also most often ignored if the those girls are not aware of this condition, or if they are not make aware of this condition by we people or the guardians or by media. That is very important. What is that? If it is not treated or it is not kept under control, again they will suffer from infertility. That is failure to conceive after marriage and so. That is one point. And second part is very disastrous. What are they? In the midlife phase, they will start having the features of diabetes, type 2 diabetes mellitus, second hypertension, third hyperlipidemia, that is high cholesterol in blood, fourth even they land up in cancer, endometrial cancer may develop, apart from strokes and other things, all metabolic problems. It is a metabolic disorder, it is an endocrine and metabolic disorder. So all metabolic problems are likely to appear during that time, the later part of the life.
Right, sir. So thank you so much, sir, for such an informative discussion on two commonest problems that are encountered in adolescent age group, the endometriosis and PCOD. So thank you very much.